As we speak now, we have 50,000 active cases in Gauteng province. We are second to KwaZulu-Natal in terms of the number of active cases. We have just surpassed the Western Cape. This is an indication of where the province is going. So you must know that Gauteng is largely a hotspot area. The 3 metros are hotspots areas as declared on the 28th. But as we speak now, we are principally a hotspot as a province. What we are feeling now is a combination of, number one, the interactions that people had in December, especially mid-December to Christmas, in the run-up to Christmas. We had lots of places where gatherings were taking place, and I explained this, that in some instances, young people were the drivers of this partying, including in some instances just where young people just came together violating regulations on highways, R80, Mawapani R80. It's an example of that. And the message to young people is that COVID-19 is, especially the second variant, is also very deadly. A lot of young people, the hospitals are reporting to us that a lot of young people are also getting admitted in hospitals. Our overall fatality rate is still at less than 2%. That's 1.8%. That's the overall fatality rate in Gauteng province. But when we just do a comparison week per week, we are seeing that the number of people succumbing to COVID-19 is increasing quite significantly. In the last week of December, it has increased by 123%. In the week that follows, right up to the early January, it increased by 155%. And as we speak now, it has increased just by 10%. So we are recording quite significant, in a week, losses of life. I want to emphasize that although we have doubled the capacity we had before the first wave, but just given what the indications are that the second wave is going to be more in all indicators, we would like to appeal to communities in Gauteng to help our healthcare system by continuing to sanitize hands and wash hands, by continuing to wear masks, and by continuing to social distance, and by staying away. If we can afford to do so, let's not go to funerals in the way we used to do those, unless it is a family funeral, at which there should also be very, very careful considerations and measures.